in this week we have this adult CPR, and next week we will have infant choking and adult choking. Okay, and these three procedures you have to do on the exam in one room in 5 minutes. So adult CPR, adult choking, infant choking. So, and this is the one room. This will be one room where you don't have to say that hello, I'm Dr. No. Okay, that I have to wash my hands or something, or I have to put the gloves on my hands. So you don't need this everything to say, because imaginary the situation is happening outside somewhere, not in the hospital. So, and when you will enter the room, I think that one mannequin will be in this position, like down on the carpet, and the infant, like the baby's mannequin will be on the table. And if you see the checklist, there is written that it starts with the choking, adult choking, infant choking, and adult CPR. Okay, but it's up to you with what you will start. You can start from CPR because it's already down, it's ready for the CPR procedure. Then take the mannequin and do choking adult, and then take the baby's mannequin and do the choking infant. Okay, it's up to you. So I wrote these letters because these are the steps, how, like a step by step, how to do CPR. What is CPR? Do you know CPR? Like the meaning of this letter?
Cardiopulmonary resuscitation.
Cardiopulmonary resuscitation. Yes, this right. So, and these are the steps. First, 3 letters. It's DRS, and then you have to do doctors A, B, C, D. Okay. When you see someone outside in the street or somewhere, someone fall down, or you see someone is unconscious or something, the first that we have to do and we have to check is that we have to check what's happening around him. So situation around, how is he in a safe place or not? Okay, if he's under the car, you have to take him on the safe place, right? So that's why first one is D. This is the danger. When you will enter in the room on the OSCE exam, during the OSCE exam, you have to go to the mannequin and you have to say that there is no danger. Okay. Then we are interested in this patient is conscious or not. That's why we are interested he's responsive or not. So we have to go down. Come. So go down on the carpet. Okay, we have to check the response. The response we are checking, like we have to take our hand and we have to tap either on the arm, either on the shoulder. Okay, never ever slap in the face. So, are you okay? Can you hear me? So we are making a physical contact and verbal contact with the patient.
How about this bones, like here? On top of the chest here, this bones. This bone.
Bone?
Here, tap on the bone.
Like here?
Bone?
Yes, when you call the patient, like, can you hear me from this bone, right?
Well, the bone, this bone, I don't know, but I know that here or on this here.
So in
Arm or
pre-paramedic, when we had like a license for pre-paramedic in Saudi Arabia, they teach us that tap on these bones, so it's easy near the ear of the patient, so he can at least hear you if he was able to be more responsive.
Hear you, even the voice, you were asking the question, so physically you were tapping and verbal contact you're having. So, and if he little bit he's responsive, he will maybe open the eyes. He won't say maybe anything, but open the eyes. He will do something, okay? So if he's responsive. So first check the danger, then check the response. Are you okay? Can you hear me? So we can talk with him too. So there is, you have to say this on the exam. Are you okay? Can you hear me? So there is no response from the patient. That's why after response we have to shout for help. But how we have to shout? If we will just shout that someone please help me, someone call 911, no one will come because everyone is waiting for someone. That's why you have to call 911, you come and help me. You have to directly ask someone to do something, okay? Because you call 911, so she knows that she has to call and she's not waiting for someone. You come and help me, he knows that he has to come and help you. Okay? On the exam, after checking the response, you have to say that you call imaginary, just imagine around you there is somebody around you. So you come and help me, you call 911. After this, you start like a vital signs you're checking. A, B, C, D you are doing. A, this is airway. 2 airways we have. We have a nose, we have a mouth. We have to take the head and tilt the head a little bit back. And we have to look into the nostrils. We have to look into the mouth. So block it, we are checking, right? Maybe it's blocked with something, and that's why you cannot breathe. So you have to look inside. After checking the airways, we have to do, like we have to check breathing. So breathing, we have to check, we have to go closer to the patient, and our head is going like this, because our eyes must see the chest. Okay? With this side, we are hearing and feeling he's breathing or not. With the eyes, we are looking at the chest. And parallel of this, I have to take my finger, and I have to put on the carotid artery, I have to check the pulse. The pulse I have to check during 5 seconds, not more than 10 seconds. So more than 10 seconds, you're not losing time to check the pulse, because if it's beating, when you will put the finger, you will feel it, okay? 10, 20, and 1 minute, it doesn't need to find the pulse here, okay? If it's beating, 5 seconds is enough to find it. You know that carotid arteries is even the bigger, so yeah, and it's very easy to find this beating here. So, breathing. How we are checking breathing?
But one question, do we have to tilt the head while checking the breathing or
No, to tilt the head back, it means during this you are checking airways. You have to look inside the nostril and inside the mouth.
So I have to
Then
go
breathing.
like this, and then put my
2 fingers
yeah.
on the carotid. I have to check the pulse during
5 minutes. During
Five,
checking the breathing.
5 seconds, not more than 10 seconds. Okay? So there is no breathing, so he's not breathing. There is no pulse. These two are the reason. That's why we have to start itself the CPR procedure. Maybe he's unconscious. Patient is unconscious. He's not responding anything. But then you find the pulse. He's breathing. In this time, you don't need to do CPR. Okay? He's unconscious. But he has a pulse. It means that he's alive. He doesn't need CPR. He does just need the doctor. Oh, we finished.
Hello. I just came to check the procedure. It wasn't the test.
Oh, just his house.
Yeah.
If there is a pulse, it means that he doesn't need the CPR. But those two signs that he's not breathing and you did not find the pulse, these are two signs that gives you the reason to start CPR. Okay? For CPR procedure, we have to know the place where to put the hand. We have to know which hand to put first. We have to know how many compressions we have to do, how deep we can go, and how faster we have to do these compressions, like a speed. Okay? So after checking this, there is no pulse, he's not breathing. I have to do CPR procedure. I have to put my non-dominant hand. You have to say that non-dominant hand because, like, if you will say left or right, it's not right because for someone, non-dominant is right. For someone, non-dominant is left. Yeah. That's why we are telling that I have to put my non-dominant hand on the sternum where the nipples are crossing each other, and only this part of the hand we are putting, not whole hand. For example, this is the sternum. This I am putting, okay, not whole hand. I have to put my non-dominant hand on the sternum where the nipples are crossing each other. Only this part. The fingers are up. I don't need the finger to be down. With my dominant hand, I have to take my dominant hand, make a fist around this hand. Fist. Okay. And now you have to say that I have to do 30 compressions, 2 compressions per second. I can go 5 centimeter deep.
I have to do 30 compression, 2 compression per minute,
Second.
per second, and I can go 5 centimeters.
5 centimeter deep. Okay? My hands must be straight. That's why you have to be over the patient. Like patient must be under your body. Okay? Go there closer and be like this. And when you are compressing, you don't have to bend in the elbow. Okay? Maybe some students, if the student will do on the exam compressions like this, so it's incorrect. Okay? When you are compressing, you have to compress. You put only this part, right? You did the fist. So when you are compressing, only with this you are compressing. And when you are compressing with the whole body, you are compressing without bending here. Forget that you have elbows. Okay? Yeah, so don't and forget you have this joint. So with the whole body compress. So 30 compressions, it means that 15 seconds will be enough to do 30 compressions because twice in 1 second we are doing this compressions. Deeper. Look, 5 centimeters is like this.
Is there any signal will come in?
So when you will do the compressions, then you have to stop and say that after 30 compressions, now I have to do 2 breaths in the mouth. Okay? That's 30 compressions. Okay? Wait. So after 30 compressions, after you will finish, after 30 compressions, I have to do 2 breaths in the mouth. You have to close the nose. When you're breathing in the mouth, nose must be closed. Okay? Close the nose, and in real life, you have to take with your mouth, with your lips, you have to cover the patient's lips. Ovaries must be right around, how to say, the air not to go inside. Only your air that you are giving, only that air must go inside. Okay? But on the exam, don't put your mouth on the mannequin. 300 students must do this procedure. So how do you imagine? Just close the nose and imagine I just inhale the air and do like this, okay? And say that twice. I have to breathe in the nose.
We have to cover this whole area, like so that no.
Oh, that's what I mean. That your mouth should be over, like you must cover his mouth. So this is what you have to do on the exam. In real life, when we are doing this procedure, we have to, after 30 compressions and 2 breathing, again you are continuing 30 compressions, 2 breathing, 30 compressions, 2 breathing. Maybe during this time he will come conscious, or if not, you are continuing this before the ambulance car will come. Okay? So after the ambulance will come, they are continuing their work. That's why you need someone to help. When you are doing compressions, he will do breathing, and then he can change the place with you. Okay? And about breathing, when the doctors they are doing breathing, they are not doing mouth to mouth, right? They are using this. So, and who's doing breathing? They are back. This is the nose part. This is this part. Yes, and they are behind his head with this hand. They have to take it like this. They are fixing here, and with the thumb, they're taking like this. This going on the nose, and look, to make a hermetic around the nose and the mouth, it has this thing, okay? Like you are covering all his mouth, right? And you're closing the nose. So this one is closing mouth and the nose together. So extra air is not going inside, only with this you're giving the air, okay?
So this one is here.
No, on the exam, no. And 1, 2. So with this they're giving the air. And the last thing, if you will see, I wrote there the defibrillator. if the CPR procedure is not helping the patient, before they will take the patient to the hospital maybe, they have this kind of portative defibrillator apparatus that can give the same electroshock, electroimpulses that have in the hospital apparatus that are. They are, these ones are, it's sticking on the chest. On the picture is shown like how you have to stick there. Yeah, you have to remove, it's sticking. It's too. Okay, so there is the electrode here, and when they are turning on this, yeah, but
In here.
so for adults, both these electrodes are on the chest. For infants, because they have small chest, one is going here, one is going back. Okay, that is shown on the picture too. So for babies, you see, one is
in the back and
one
one
is here on the sternum, one is back here. Okay,
Got it? Got it?
No, I got it. Yeah.
remove it. So this is what you have. This not will not be on the exam. This will not be on the exam. So the thing that you have to do on the exam is that this steps and at last 30 compressions to breathe and to stop them. Okay? Because maybe you didn't do talking, you have to continue the talking, or maybe you did the talking before this. You will finish with this. On your place, if I was a student, I would start with the CPR. Then I would take a mannequin and do the choking with adult, and finish with the choking infant.
Done?
Done. There is no danger. Go down. Are you okay? Can you hear me? So tap and talk together. Then there is no response. You call 911. You come and help me. I have to check the airways. Tilt the head back and look into the nostrils and into the mouth. There's nothing. So airways are free. Then we have to check breathing. We are going like this. We're hearing and feeling he's breathing or not. By our eyes, we are looking the chest. And I have to put 2 fingers on the carotid to check the pulse during 5 seconds, not more than 10 seconds. There is no pulse, he's not breathing. So these are the 2 reasons. That's why I have to start CPR procedure. I have to put my non-dominant hand on the sternum where the nipples are crossing each other. Then with the dominant hand, I'm making a fist. So I have to go over the patient. I have to do 30 compressions, 5 centimeter deep, 2 compressions per minute. In 1 minute it comes 120, 100, 120. Yeah. So in 1 minute there is 60 seconds, so twice in a second. It means that in 1 minute 120 compressions. But I have to do now 30 compressions because after 30 compressions I have to breathe twice in the mouth with a closed nose. Okay? And when you are doing the compressions, don't forget to be over the patient because the hands must be straight. And when you are compressing, compress with whole body. Don't bend in the elbows. Okay? Don't bend here. Don't bend here. Forget that you have joints on the hand.